Dental implants are a type of tooth replacement that involves inserting metal posts into the jawbone and attaching artificial teeth to them. They are considered by many dentists to be the best option for replacing missing teeth because they have many advantages over other methods such as dentures or bridges. However, they also have some drawbacks that should be considered before deciding to get them. Some of the pros of dental implants are: they function and look like natural teeth, allowing you to chew and speak normally and confidently. They are durable and long-lasting, with some studies showing that they can last for more than 20 years with proper care. They prevent bone loss and facial sagging that can occur when you have missing teeth, as they stimulate the jawbone and preserve its structure. They do not decay or cause damage to the surrounding teeth, unlike bridges that require grinding down healthy teeth to support them. They do not slip or move around in your mouth, unlike dentures that can cause discomfort, irritation, and difficulty eating and speaking. Some of the cons of dental implants are: they are expensive and may not be covered by your dental insurance, as they are considered a cosmetic procedure. The average cost of a single implant in the US is around $4,000, but it can vary depending on the location, dentist, and complexity of the case. They require surgery and a long healing process, which can take several months and involve multiple visits to the dentist. There are also some risks of complications such as infection, bleeding, nerve damage, or sinus problems. They require good oral hygiene and regular checkups to maintain their function and appearance. You need to brush and floss your implants daily and visit your dentist every 6 months for cleaning and inspection. You also need to avoid smoking, chewing hard foods, or grinding your teeth, as these can damage your implants or cause them to fail. Dental implants are a suitable option for people who have one or more missing teeth, have a healthy jawbone and gums, do not have medical conditions that affect bone healing, and are willing to commit to the time and cost involved. However, they may not be suitable for people who have insufficient bone density or quality, have chronic diseases such as diabetes or osteoporosis, have active gum disease or infections, or are pregnant or breastfeeding. To conclude, dental implants are a popular and effective way of restoring your smile and oral health after losing your teeth. They offer many benefits over other tooth replacement methods. But they also have some drawbacks that you should weigh carefully before making a decision. You should consult with your dentist to determine if you are a good candidate for dental implants and what to expect from the procedure.